I think part of what's scary about it is that people see the stats on long-term care and the expenses and think there's no way I can do anything about it, so I'm not going to do anything. So just so we can scare everyone, let's do some of those stats. So on average, here we go. Whoa.
Scary stats.
So the stats, and most of this comes from AARP, but other places as well. The stats are generally speaking that about 70% of people 65 and older will need some type of long-term care. Average cost is $138,000 of any kind of care, but a stay in a nursing home across the country is an average $100,000 a year. Living in assisted living is about $45,000 a year. Some sort of adult daycare of some kind, $70,000 a day, so that's almost $20,000 a year. That's an awful lot of money. And when people see that, they think there's no way I can plan for that. But that's not necessarily true, right?
Yeah, that is exactly correct. I think part of the issue is the fact that it is overwhelming. When you hear those numbers, depending on where you live, you can be paying significantly out of pocket.
For example, like in a nursing home in Alaska is almost $300,000 a year.
Wait, what?
Yes.
Absolutely.
Highest state in the country.
Absolutely. Yeah. So when you hear those numbers, you don't know even where to start, in part because of the fact that we don't necessarily have a long-term care system that is actually person and family centered. And what I mean by that is the fact that the person and the family are in the center of these conversations. The cost for 30 hours of having someone come into your home is roughly about $30,000, $34,000, give or take. And that exceeds the vast majority of what older adults can actually afford on an annual basis. In fact, we did a study called Across the States where we wanted to put out all these numbers, the amount that it costs for nursing home care, the amount that it costs for assisted living, or the amount that it costs for home care. And one of the key findings is the fact that it's unaffordable across the country. So you do need to have a plan. And the question becomes exactly what does that plan look like? And there are 4 factors that impact typically long-term care costs. One is exactly where you live. Where you live matters significantly. The other is what type of care do you need? Whether that's nursing home care, assisted living, or home care, whether it's moving into a age-restricted active adult community or a continuing care retirement community, whether it's assisted living or whether it's adult day to provide you with some support during the day. The third aspect of this, too, is how much care do you actually need? And then, of course, for how long? So all of those 4 factors impact some of the costs that you're hearing in terms of some of these staggering numbers. But there are things that people can actually do. We know that the vast majority of people, and you can kind of think about yourself, as you age, where would you like to receive care? And oftentimes it's in your home and your community. So one of the things we're encouraging people to do is that when you go home, or if you're home right now, assess whether or not where you live can accommodate your needs as you age. And what I mean by that is the fact that are there universal design principles? And universal design features are things like, well, is there a bedroom and a full bathroom on the first floor? Why is that important? In part because of the fact that as you age, the ability to go up and down steps might become a challenge. So that's one thing to consider. Or how safe is the actual home that you live in? Are there grab bars? Are there zero entry steps, meaning the fact that can you get up into your home without having to take the steps in there? Are there handrails? What are some of the modifications that you can actually do in your bathroom? Or what are the things that you can do to basically live independently for as long as possible with a sense of dignity? And the earlier you can actually start that process, the better off you'll be, just in terms of assessing and then coming up with some form of a plan. We think about what our current needs are today, but can where we live, eat, play, work, can those homes and communities accommodate our needs as we age? That's a question. And I think that one of the things that's extremely important for us to kind of think about is to imagine the future that you want for yourself. The earlier you can actually start planning, the more likely you are going to be able to have more choices, more options. And it helps to reduce the sense of stress and the sense of being overwhelmed by some of these stats because you have a plan in place. And it also, to the extent that is possible, helps you help your family. because one of the things that we're trying to do is foster these conversations so that way your family knows exactly what you want, and more importantly, you're in the driver's seat in terms of executing in terms of what you actually want. So that's one of the things. Assess what the home environment's like. The other thing that I would encourage you to do is to think about, when I look at my community, do I have the right community features in terms of, is there a grocery store that's nearby? Is there a medical doctor's office that's nearby? Can I get to and from? Think about it. Your neighborhood is your gateway to all things in terms of social engagement. So what are the transportation options that are available? What are the alternatives if you can no longer drive? Are you able to get to and from? I'll give you a good example of what I mean by this. When I worked for the federal government, I had an opportunity to actually do a site visit to Richmond. And I got an opportunity to talk to someone who was part of a program who transitioned out of a nursing home back into the community. Check this out, he was roughly in his early 40s. Former police officer,
Wow.
Tragic situation, gunshots, paraplegic, so you can kind of, was in a nursing home for quite some time, was able to transition out of the nursing home back living with his brother and his brother's wife in a beautiful home in Richmond with a beautiful lake. There were some home modifications that were done to accommodate the gentleman's needs. And when we started to talk to him about exactly, can you kind of talk to us or walk us through your day? What he said was the fact that every day that there's a personal care attendant that comes in and is with him during the day and leaves around 1 or 2 in the afternoon, and his brother and his brother's wife doesn't come home until about 5 or 6, right? So from 1 to about 5 or 1 to 6, he's pretty much isolated in this home. And he said, look, I may not have the physical abilities, but I still want to work. I'm mentally sharp. There's a lot I can do, but I'm having a hard time getting to and from. So we said, well, or how engaged or integrated are you in the community? He said, well, we live in a cul-de-sac, and the public transit only comes to the entryway of the neighborhood. So they're not going to come to the front of the entrance. So that was an issue, right, that we had to try to figure out how to resolve that. Here you have someone who wants to be socially engaged, who wants to contribute and provide value, but because of this infrastructure and some of the barriers in the community, was not able to do so. So I think it's also important to kind of think about exactly, as you age, what are the options in your community to support you in your aging process? What are the abilities in terms of transportation, in terms of social engagement, in terms of the different types of opportunities? And we have a tool called the Aarp Livability Index that you can actually go in, you put in your zip code, and it'll tell you exactly how livable your community is. And that's for all ages and people with disabilities. And the other aspect of that, too, is to understand exactly what are the different types of programs that are available to support you as you age. So, again, we hear the stats. You're $100,000 for nursing home care, $34,000 to get someone to come and provide you 30 hours of care, and that can be overwhelming and frankly stressful, right? But there's a lot of programs and opportunities at the local level that may offer services on a sliding scale, whether that's home delivered meals, whether that's transportation options, whether that's caregiver support. So I would encourage you to look through your local area agency on aging and find out exactly what services and supports are available for you in your community. Or if you are a daughter or son or a friend caring for someone who's long distance, what are those different types of services that are available in that person's community? So that's something else you can actually think about in terms of planning for your long-term care needs.
When people think of being older and healthcare needs, they think of things like Medicare.
Mm-hmm.
But how much can people expect from Medicare and maybe Medicaid in terms of helping with a lot of these costs?
So that is a very good question. One of the biggest myths and misunderstandings is the fact that Medicare will pay for long-term care. Or your private long-term, your private insurance will pay for long-term care, and in fact, Medicare nor your private insurance pay for long-term care. They just don't. That's just one of the areas where they don't cover those different types of benefits. And when we talk about long-term care, we're referring to things like assisting you with your bathing, your dressing, your eating, your medication management, or helping with managing finances, or taking care of transportation, some home modifications. So these are personal social support activities that you need assistance with. And Medicare doesn't cover that. Medicaid, on the other hand, does. But in order to qualify for Medicaid, you have to have limited resources. And it varies by state in terms of the eligibility requirements. So it would be very important to assess what the eligibility requirements are in your particular state. But on average, you can only have about $2,000 worth of countable assets. And that excludes the home, but depending on your state, it depends on the equity in your home. So there's limitations there. I want to kind of go back to something else that I mentioned, is this whole issue about choice and why it's so important for us to plan ahead and plan as much as we can with respects to long-term care, because it increases your options and it increases your choices when you actually have a plan in place. So what do I mean by that? Well, in the context of Medicaid, if you do become eligible, meaning the fact that you've met their requirements for eligibility, nursing home care is a required service, meaning that every state has to offer you nursing home care. So if you're eligible, automatically you would be eligible for nursing home care. Home and community-based services, that means getting services in your home, is an optional benefit. So states are not required to offer that. And the states that do, they offer, but there's limitations in terms of the caps, the allotments. So in some cases, there might be long waiting lists to actually get these services.
Yeah, you talked about being in the driver's seat with this. Once you get to the point where you need Medicaid, you're no longer in the driver's seat.
So there's again, it really depends on where you live. Okay. It depends on where you live in the sense that some states provide you with the option to get home community-based services, so you can actually get those services in your home, but you have to go through the process of being eligible. Some states provide what we refer to as consumer-directed care, so it allows you to be in the driver's seat. But what I mean by increasing options is the fact that once you've gotten onto Medicaid, because there's so many different factors that comes into play, you could potentially be in the driver's seat, but it depends on whether or not the services are available, not just in your state, but also in your geographic area.